Hello there, and thank you for joining me for another hormone rescue session. This is where I'm telling you all the things that no one else will tell you about hormones, how hormones impact every part of your life as a woman, and how hormones make you the woman that you are, and what we can do to bring them into alignment and rebalance them if they are a little bit out of control and you're feeling like you're in a state of chaos. This is one of my favorite topics, hormone-related conditions, common hormone-related conditions, and breast cancer. I want you to arm yourself with the knowledge for prevention and early detection when it comes to these imbalances. Because if you're suffering from a hormone-related condition, you are out of balance, which may very well lead to a hormone-related cancer. So by balancing and managing yourself early on, you're helping to protect yourself in the future. And like I said, very near and dear. I don't want to babble about it too much. I want to go through and help you to understand that. I do want to make sure that I give a disclaimer that I am not in any way going to say that I'm going to treat or cure cancer. As I go through these slides, what I'm telling you is it takes a whole approach to the management of cancer. You need to understand the root cause, things that contribute to cancer diagnosis, just as you need to understand the things that contribute to a hormonal imbalance and what we can do to optimize your health and your benefits of cancer treatments. So I am Marsha Jones. I am a nurse practitioner and I specialize in women's health in the functional medicine realm. I love to free women from that physical, mental, and emotional exhaustion that they are experiencing because of a hormonal imbalance or adrenal burnout. I myself suffered from an adrenal burnout, which had all of my hormones in quite the state of chaos back in my early 30s. That's how I discovered functional medicine for women and how I perfected it. I took care of myself. I want to say cured because it wasn't a diagnosis, a disease, but I put myself back on top. I went from, being a little pudgy, which I didn't realize till I lost 30 pounds, put my hormones back in check, got all my energy back, started sleeping again, and just everything fell into place. And I've never looked back. I am in better health now than I've ever been. I'm in better shape now than I was in my 20s. And it's all from the knowledge that I have gained through functional medicine. And I want to help you as well. So, last but not least, in our series of hormone rescue, I'm going to go into those common conditions of women that women face and breast cancer. So this is a new era in cancer care. I truly believe that this is a new era. 1 in 3 women are going to develop cancer in their lifetime. Breast cancer is now the #1 cause of cancer. Only 18% of cancer survivors are going to live 20 years after treatment. 69% of those will live 5 years. Let that settle for a minute. Here's my favorite statistic, and yet the saddest statistic. 90% of cancers are preventable. 90%. The thought of cancer brings life to a complete stop, and it's followed by a roller coaster of emotions through every phase of the journey in a woman's life. Sometimes that emotional journey is much harder and yet more therapeutic than the physical journey of cancer. Now, during my career, I've seen a lot. I've cried many tears. I've held many hands, given a lot of hugs to both patients and their loved ones in the cancer journey. So this hits very near and dear to me because I've seen what cancer can do. And every single encounter in my career has had an impact on me. Every single woman, every single person. Because these encounters and experiences in my own life, in my professional career, and even in my personal life are why I do what I do. I don't want to see somebody suffer ever. If there's something I can do to help, I'm going to do it. And here's my intentions for you today. I want to replace fear, uncertainty, and despair with answers, guidance, and hope. That is what I'm doing for you. That is my intention for you. Now, here's the truth about cancer. There is no cure. Cancer doesn't care who you are, how old you are, what your plans are, what your status is, what you've got going on, whether you want it or don't want it. Cancer does not care. Cancer is also not an emergency. When you get the diagnosis, you feel like it's an emergency, but it didn't happen overnight. This is how cancer happens. This is my definition of cancer. It's a lifelong, genetically predisposed metabolic disease of the mitochondria that requires a lot of energy, resulting from an immune system that has been broken by toxic exposures and a lack of nutrition, fueled by inflammation, which is rapidly on the rise, targeting estrogen-dependent reproductive organs and the #1 cause of death in the United States. This is my definition of cancer. This is where the Hormone Rescue series has come from. This is what I do in functional medicine, is I manage each and every one of these pieces of the development of cancer to help to protect you from developing cancer. If you've had cancer or have cancer, I use every piece of this to help you to survive your cancer and to thrive beyond. Because cancer came from something and cancer can happen again. You are never safe. And that's a sad statistic. But the world we live in, with the toxins we live in and the lifestyle that we live, is what is causing this wild, rampant cancer epidemic we're in right now. My part is to help you as women with hormone-related cancers to understand all of these things and what you can do about them. Now, we don't know everything about cancer. We really don't. But there's a lot we do know about cancer, and there's a lot of things we can do for what we know. There is a hormone focus because hormone-related cancers are the #1 cause of cancer. And as you know, hormones are chemical messengers. There's over 45 in the body, and they are all connected. And then we add, that inflammation and things that I just mentioned in that definition onto hormones that are out of balance, and you can see where things get out of control. These are the top 5 hormones of cancer: estrogen, progesterone, testosterone, insulin, and cortisol. We have talked about those throughout this entire Hormone Rescue series. We're going to keep it simple. The primary female hormones: estrogen, testosterone, and progesterone. Estrogen is naturally produced. It's controversial, but essential. It is what makes us women. It's what makes us who we are. It is amazing. For breast development, production of the endometrial lining, maintaining vaginal tissue, bone development, protecting our heart, our moods. Estrogen does all of this. Estrogen gone bad, though, is either too much estrogen, the wrong type of estrogen, like those fake estrogens are called xenoestrogens, or it's not being processed and metabolized correctly. This can be because of a metabolic problem. This could be something genetic. So these are the parts of estrogen that we need to worry about and we need to focus on in our hormone-focused cancer care from a functional perspective. Estrogen exposures and poor metabolism are the primary factors in estrogen-related conditions. So estrogen imbalance or a dominance of estrogen increases your risk of cancer. That is the worst outcome of the estrogen imbalance. Things that elevate estrogen. Well, first of all, we have natural hormone cycles. We naturally cycle, and our estrogen goes up and down throughout that phase. Birth control, that puts estrogen into us. Animal products, because our animals are injected with hormones, and those hormones get passed along to us through animal products. Adipose tissue. Fat cells secrete estrogen, so by maintaining a lean body, we can help to control this. Alcohol is processed in the liver. The liver has a lot to do with estrogen metabolism. Then we have those xenoestrogens in our personal care products, home products, plastics, pesticides. All of these things can raise your estrogen. Now, progesterone, this is produced by the ovaries and plays a role in breast and uterine activity, and it has a direct relationship with estrogen. It also has a role in our menstrual cycles. Too little progesterone with too much estrogen can cause breast changes. And then, yes, ladies, we have testosterone, which can be aromatized into estrogen. Okay, there's more estrogen piling up now if it is being aromatized, and that just means converted into estrogen. And there are things that we can do to stop that conversion, things like decreasing our inflammation. Then we have insulin. Insulin is a growth hormone. It's a metabolic hormone. It promotes tumor growth, and it's pro-inflammatory. We need to control our insulin levels. Then we have cortisol. We've talked that cortisol can increase insulin levels because it increases glucose. Stress hormone, it's a metabolic hormone, reproductive hormone. It has a role in immune function and it regulates our inflammation. So think back to my definition of cancer. So now here's the conditions of hormone imbalance. Hormone imbalances that you might recognize are fibrocystic breasts. There's not breast cancer, but fibrous, dense breasts, obesity, endometriosis, PMS, and PCOS. You may never have thought about obesity before as a hormone imbalance or an estrogen imbalance, but now you do. So cysts and fibrous tissue are not cancer and do not cause cancer, but they are a sign of an imbalance. Estrogen and inflammation are what are involved in changes to the breast tissue. Those are the things that we need to be very mindful of. PCOS. PCOS is a condition of increased insulin, increased androgens, or that testosterone, obesity, and anovulation, meaning you don't ovulate. So any of those things in there you can pick out that were in the definition of cancer. PCOS, you might have irregular periods, you might have ovarian cyst, excessive body hair, weight gain around the belly, acne, oily skin, infertility. And then we have endometriosis. This is where the endometrium grows on the outside of the uterus. This is associated with high estrogen levels. And there's an increased risk for ovarian cancer with endometriosis. Now, endometriosis can be very painful for a woman, and it's hard to diagnose because it can mimic so many different things. You can have low back pain. You can have, pain in your stomach, like all these things, but it's actually this endometrial lining that's growing outside of the uterus and attaches itself to your organs in the abdominal cavity. So that causes that pain, inflammation, and irritation. The only way to diagnose endometriosis is by doing a biopsy. So you have to be very mindful of symptoms and look for things that connect, like painful periods, painful sex, chronic pelvic pain, painful bowel movements, low back pain. All of these things can be a sign of endometriosis. Then you have irregular menstrual cycles, which you might not think as a condition, but it is. And it results from an imbalance of hormones also. And it's a very high indicator for an increased risk of hormone-related cancers. PMS. PMS is a hormonal disruption. It's estrogen surplus and progesterone deficiency, just as everything we're talking about is. There is a imbalance between that estrogen and progesterone and your other hormones. PMS, you'll notice weight gain, abdominal pain, headaches, swelling and tenderness of the breast, nausea, constipation, anxiety, irritability, anger, mood swings, crying. You're just all over the place. That's PMS. Now, an extreme PMS is premenstrual dysphoric disorder. This is very, very extreme symptoms of imbalance. And remember, estrogen helps to regulate serotonin levels. Progesterone is very calming. And testosterone maintains neuron functioning. So if you're having an extreme disorder, mental disorder during your menstrual cycles, then we need to definitely look at this because this is what's happening. Estrogen, serotonin, progesterone, and testosterone are all out of whack. Now, obesity. Obesity is a single risk factor itself for the development of hormone receptor positive breast cancer and has been associated with an increased risk of recurrence of cancer and reduced survival rate of cancer. So that, 69% rate, that's what we're talking about. So the hormone obesity breast connection, all right, it's an inflammatory condition. Obesity is inflammatory. It's a metabolic condition associated with poor glucose metabolism, elevated insulin levels. And remember, I told you estrogen goes directly to the breast tissue. Progesterone and testosterone help to balance estrogen levels so it doesn't go straight to the breast tissue and cause problems. Then we have inflammation. Obesity is an inflammatory condition. This is the fuel on the fire for breast cancer. Adipose tissue converting androgens into estrogen because of inflammation. That's estrogen via aromatization, just because of the inflammation. So when I told you that adipose converts adipose tissue or fat tissue makes estrogen, this is why, and this is how. And then that estrogen stimulates your breast tissue. And what happens when the breast tissue is stimulated and then there's inflammation? and an imbalance of the other hormones, you're at an increased risk for breast cancer. So without addressing the root cause of your hormone imbalances, you increase your risk of developing cancer, no matter what condition you have. All of them are warning signs. So the hormone cancer connection, this is it in a nutshell. Hormone imbalance, estrogen metabolism, insulin, inflammation. And here's the current cancer care model. It's a focus on destruction. And I'm not telling you it's bad. What I'm telling you is there's more, okay? Functional medicine works very well with cancer treatments because their job is to come in, find it, destroy it, move on. There's a lack of cause analysis. They'll do genetic testing, absolutely. But as far as the inflammation, the obesity, the glucose metabolism, the insulin levels, all those things that I've talked about, they're not looking into that. That's what functional medicine does. There's a lack of nutritional guidance. I've way too many times heard, have a milkshake, eat whatever you want. No, you have to decrease the amount of sugar that you eat. There is a very, very specific cancer-focused nutrition plan for a woman with breast cancer, and it does not include milkshakes. I'm sorry. A lack of emotional support. And again, it's their conquer, destroy. That's their motto. That's what we need them for. But the emotional support of, all of the phases that you're going through, it's traumatizing. It's very traumatizing. And then the whirlwind of treatments and appointments is even more stressful. And you don't have time to think or process or, go through the emotions that you need to deal with. That's where functional medicine comes in. Then there's a lack of complementary therapies, things like IV vitamin C, infrared sauna, nutritional guidance. All of these things matter in your care and they're not addressed. And then there's poor life after treatment support. And I say this because they give the false sense of cured. Remember, I told you there's no cure, and I told you why there's no cure. We have to do everything in our powers to identify the glitch that happened that created the cancer in the beginning so it doesn't happen again. And let's face it, you have a risk just because you had cancer. There's always still one cell that could get loose, that could, in the right circumstances, turn into cancer again somewhere else even. So there's a lot more to cancer care than chemo and radiation. That is what I'm trying to express to you. And this is my dear friend, Sandy. Some of you may have heard me talk about Sandy before. She's a true inspiration for hormone-focused cancer care. She's an inspiration to any woman who has been diagnosed with cancer or has a family history. Miss Sandy was diagnosed with breast cancer, and she was, went through the standard treatment. She had children, so of course she did everything she was told to do in the conventional care world. They told her she was cured, have a nice life, we'll see you once a year. Okay, well, Sandy, very big in functional medicine, a lover of holistic, all things holistic, did not want to take, prescriptions if she didn't have to, but ate right, did all kinds of things well for herself, or so she thought. She did see a naturopath who was helping her along her way, and the naturopath did some blood work, some testing that showed that maybe the cancer had returned. And this was 5 years after she had been told she was cured. Told her to follow up with her oncologist that she'd been seeing every year. So she did. Oncology said, no, we don't need to do anything else. You're cured. We don't need to, she was getting her mammograms and stuff, once a year. But this slight change before it was time for the mammogram again, sent them, her on a mission to get someone to listen to her, to do the testing that needed to be done because the naturopath couldn't order the imaging studies. Lo and behold, after, much insistence with her oncologist, they said, we're not going to find anything, but we'll do it. Well, Sandy had a recurrence of her breast cancer, which was now metastasized to the liver, and it was stage 4. So here again, in conventional care, she was told, basically, go home and die. There's nothing we can do for you. So first they said, you don't have cancer, you're cured. You can't have cancer, we cured you, to, oh, you've got stage 4, so sorry, go home and die. Sandy did not accept that very well. She's a very, very faithful woman and very optimistic. So during this time, she started a support group for other women because other women needed to know, what they could do for themselves and for their health and to help them through their cancer journey while she's going through stage 4 cancer. So she uses a functional medicine approach, an alternative healthcare approach, and she lives another 6 amazing, wonderful years with her family. She did pass away recently, but her 6 years that she had left with her daughters were full of life and energy and vitality. They were not miserable. She did not die when they told her to go home and die. She fought for another 6 years. And it wasn't a fight of misery, it was a fight of happiness and hope. And I do believe Sandy's purpose was to bring more of this type of care to women like you. And she knows that was her mission. So thanks to Sandy, I too continued with her mission and her legacy. Yeah. Anyway, sorry, a moment for Sandy. The functional formula has been born to also incorporate the assistance and care of women suffering from breast cancer with a history of breast cancer. I, again, do not treat breast cancer. I assist you through your journey with breast cancer. Your natural options, holistic advice that you can use to help treat those root causes. So we identify the root cause of imbalance. We protect your body from damage. We repair the gut and the immune system because cancer happens to a broken immune system. We rebalance the hormones, body, mind, and spirit, and we rebuild your energy and resilience. We work on genetics, hormones, insulin, inflammation, immune repair, mitochondria, metabolism, obesity, toxins. This is functional medicine, ladies. Like toxic burden, what this is an overload of the immune system. It limits full recovery from your cancer. It increases risk of toxic effects from chemo and radiation. When fighting cancer, a clean system is required to repair and rebuild. This is why I said there is no cure for cancer. There's a lot we do know, but there's a lot we don't know. We have to get this out of the way. And it's also why I said that cancer is not an emergency. This has taken years for all these things to develop, years of toxic overload. Give your body a chance to heal and to reset as you go into your cancer treatment. If we do, say a detoxification program before you start your chemo and radiation, you're going to do better with it. It's going to work better. You're going to have less side effects. I do protocols in conjunction with your traditional conventional cancer care. I do not work against your oncologist, okay? I do not replace your oncologist. I help you to understand all of the things that contribute to cancer as I defined in the very beginning. And I help you with toxic burden and how to get rid of that. And I want to also tell you to be very careful. I don't want you to take this, listen to this and go, oh, well, I'm going to do a detox if I have cancer, because we've talked in the other modules, you can't do that. Because there's a lot of things that have to do with detoxification. You've got to make sure that you can eliminate. You've got to make sure your liver is healthy. You have to do all these things, or those toxins that you're trying to detoxify are only going to continue to recirculate in your system, and they're going to cause you more harm than good. And they could actually run the risk of shutting down your liver and making your cancer spread more rapidly. So please do not try to do this on your own. You need to fuel the body. This is what we do in functional medicine. We work on elimination, self-care. We address the mind and heal the spirit. It's a very emotional journey. We help balance hormones. We decrease inflammation. Here's a very important hormone balancing alert for you as we're talking about all of this. Hormone replacement therapy must be managed very, very carefully. Hormone replacement therapy is phenomenal. I do it myself. I have many women on hormone replacement. Phenomenal, but it must be done correctly. We have to make sure that your liver is working correctly. For one thing, we have to make sure that you're eliminating, or all of that hormone is only going to become a toxin and recirculate in your body. Bioidentical and natural supplemental rebalancing techniques. Never use a synthetic source. Do not ever take an estrogen pill. Be very careful of the things that you're using to rebalance and replace hormones. There are many providers out there who mean well, but don't understand the toxic burden of estrogen. We usually have two extremes. We have one end of the spectrum who thinks that everybody who takes hormones is going to have cancer and die. Then we have the other end of the spectrum who's like, I don't give you hormones. I don't care. And so we need something somewhere in the middle. Both ends are dangerous, because one end is just going to leave you to suffer and be miserable and not give you any relief during, hormonal fluctuation like menopause. And then there's the other one who's just handing it out like candy and not understanding what they're dealing with. And then you're at risk because of that. So be very careful when you choose hormone replacement therapy. The ones that I see now on TV, and just here, sign up, fill this questionnaire, and we're going to send you your hormones. Are you kidding me? Like, they don't know anything about you. That is so dangerous. Those are lawsuits waiting to happen. Yeah, like, you don't want to hear me talk about that. But anyway, you must be mindful. Testing is very important. Advanced testing of hormones and how they're metabolized is what's important. This right here, I want you to see, this is advanced testing of hormones. Anyone that has breast cancer, I do this test on them. Anyone at high risk for breast cancer, I do this test on them, because how your estrogen is metabolized makes all the difference. You have 3 different types of estrogen. It isn't just estradiol that we check on blood. This is a urine and saliva test here. Your estrogen has to go down a certain pathway. This is a protective pathway. This is a dangerous pathway. This is a down the middle kind of pathway. And then you've got a green one, anything that's green is good. But all these little red arrows on here show that this person is not metabolizing and detoxifying their estrogen. Even if their estrogen level on blood work is normal, this could be happening underneath. And so every little bit of estrogen that you do have is not being metabolized or methylated properly. And that is part of how cancer happens and how you're not recovering from cancer or you have poor outcomes. These are very important tests. This is a bigger view of that. And this one just shows how it starts at the top with pregnenolone and works its way down with all of the other hormone cascades to where we get into the estrogen cascade. Again, I don't want you to have to understand all this. That's my job. We just want to know we don't want a bunch of red. That is a huge chunk of red on this pie chart. And that means this person is in danger. And look how big this red pathway is that's running down there to the bottom. More of the same. This shows another pathway where all of these are in the red zone. And then this is all blue and there's only half of the green. The green should take up most of the pie chart. So just because there's only a little sliver of red here doesn't mean this woman is safe. That is functional medicine for every woman. Okay. I have went over this in every module of, how I feel about hormones and women and healthcare. I encourage you to take action. I truly encourage you to take action. If you have any of the symptoms, any of the clues, anything in your gut doesn't feel right, that you just know there's something wrong, trust your gut, trust your intuition, get evaluated, book that call with me so that we can talk about it, so that we can start down your journey to understand your hormones, your imbalance, your care, and what we need to do and how we need to get you safe, protected, rebalanced, resilient, get your energy back, get you out of crash and burn so that you can live a long, healthy life that's full of energy. No one wants to age poorly. We want to age well and happy. This is how you get with me. hormones.marshajonesnp.com/book now, or simply go to marshajonesnp.com. And when you go there, there's going to be a book button all over the place. You just get hooked up with my calendar so we can, schedule that session. We can talk more about you. We can deep dive into who you are, what programs I have to offer, and how I think I can help you. If I can't help you, I'll be completely honest with you, but I think you've probably gotten at least one thing throughout all of this that sounds like you and what you're struggling with, and you know in your heart that I can probably help you. So book that session so we can start rescuing you from your hormones. Thank you again for attending. I really appreciate it.